Hello everyone. A little introduction about me. I am Dr. Laika Khadri from Bangalore, India, and I am involved in evaluation of comorbidities associated with COVID, and I am consistently finding the COVID diagnosis and management procedures. Coming to the topic, COVID and sepsis uh, are the two conditions which share many pathophysiological and clinical features. Both sepsis and COVID 19 patients experience a very similar pattern of predisposition and prognosis. Uh, Now, COVID, as we know, it is a very novel disease, as has been described since 2020, and we have been consistently the researchers and the scientists are working on to find the diagnosis, therapeutics, and many medical procedures which can uh, be used for management of COVID. Now coming to the topic, the topic which has been given to me is the inflammatory markers in hospitalized COVID patients leading to sepsis. So most of the patients who have been hospitalized due to a bad prognosis of the disease, the symptoms which initially began just with which seems to be similar to cold and fever. So the certain patients had the ability to manage these symptoms by their own, but most of them during the first initial waves of COVID, they had to be hospitalized, and these patients were being diagnosed to also have the similar symptoms as seen in sepsis. Uh, so let us discuss a little bit more about sepsis and how the symptoms of sepsis overlaps with that of COVID. Now, when we speak about sepsis, now this particular condition in a patient will have certain inflammatory markers which are elevated more than a manageable concentration. Now, the chronically elevated markers are some of the markers are interleukin 6, tumor necrosis factor, CRP, that is C reactive proteins, D dimers, fibrinogen. So all these, you can make a list of these inflammatory markers which gets elevated in the patients who are diagnosed with COVID and sepsis, similarly. Now, when we have to talk about the difference between this in the older individuals and the adults or the younger, individuals. Now, sepsis is mostly prominently seen in older individuals because they have higher levels of inflammatory markers. Now, these inflammatory markers increase by age due to certain reasons. So, one is they have less regulated immunomodulations, and they have higher concentrations of ACE2 receptors and higher concentrations of inflammatory markers like cytokines, chemokines, and they have more peroptosis triggering mechanisms increased in their localized tissues. So let's see how younger individual and the older ones react when they are contracted with certain infections. It need not be only COVID. So any infection may lead to exacerbations of their responses. So why this immune responses exacerbate in certain individuals, and which is not seen in younger or adult populations. Now during aging, what happens is the antioxidant system declines, which leads to imbalance of the redox status. Now the activation of redox sensitive transcription factor, that is the NFKB, is increased in older individuals. It leads to pro-inflammatory mediators including TNF and IL-6. So this is one of the reasons. Then high circulating inflammatory cytokines like IL-6 are associated with increased risk of severe sepsis. So this is one of the it is a marker, a prominent marker which is seen in older individuals, which leads to severe sepsis and mortality. Now the inflammatory responses also activates and in turn is activated. So it has an autocrine reaction. So IL-6, when it is secreted, it has an autocrine effect on the cells, which in turn increases the releases of many other cytokines and chemokines. Now higher circulatory cytokines it promotes vascular leakage, vasodilation, microvascular dysfunctioning, and increase in organ hyperperfusions. So all these are the stepwise reactions which increases the inflammatory reactions in an individual which has higher levels of inflammatory markers seen in their blood. And it also increases the ischemias in the older individuals, leading to sepsis. Next, coming to the immunomodulators. Now when you speak about immunomodulators, these immunomodulators are lesser in concentration seen in older adults as compared to the younger or the adult populations. So there are n number of factors. Now IL-10 is one of the cytokine which is responsible for immunomodulation and seen in a lesser quantity in the older adults, older individuals. So these are some of the factors. Now why does reaction has to be exaggerated in certain individuals? Now the primary cells which gets activated in the initial stages are very important, which decides whether the reaction will lead to sepsis or it leads to modulation and regulation. Now these cells are the macrophages and dendritic cells. So macrophages and dendritic cells are the front line cells, so which actually identifies the antigen in the initial stages. So the first stage of the damage which has been done by any of the factors, maybe it is a pathogen or a hormonal change or a stress, any kind of stress. There are n number of factors which can initiate an immune response. So the first frontline cells which identifies these stressors are the macrophages and dendritic cells. Now these macrophages, dendritic cells, they secrete interferons and tumor necrosis factor at the initial stages, so that the antigens are destroyed, they are engulfed, and they are processed within the cell, so that there is no further any reaction which occurs leading to a bad prognosis in that particular individual. Now these cells are prominently localized in almost all the tissues and organs in the body of an individual. Now these cells initially destroy the pathogen and stops the further increase of infection. Now if these cells are unable to do such process in the initial stages, what happens, the antigen multiplies within the cell, within the macrophage and dendritic. If it is not destroyed, it multiplies within the cell, and then it leads to secretion of more and more pro-inflammatory markers by these cells. So these pro-inflammatory markers acts as paracrine and autocrine and paracrine mechanism. So they have a pro-inflammatory trigger in its immediate microenvironment, in its immediate vicinity, and then also it has an autocrine action. So these pro-inflammatory markers which are secreted will have an effect which triggers the activation of genes, which leads to more production of cytokines and chemokines. So once these pro-inflammatory substances are secreted by the cells, that is by the macrophages, dendritic cells, in which the pathogen is growing, multiplying. So this leads to further activation of immune system. The first immune system which gets activated is the innate type of immune system, and then if this innate type of immune system is unable to process the antigen or the stressor which has entered into the body, so this immune system is insufficient to deal with a particular antigen. So another set of immune system gets activated, that is the adaptive type of immune system. Now adaptive type of immune system will have n number of cells, as we all know: T cells, B cells, the helper cells, cytotoxic cells. So all these cells gets activated, and then they all collectively try to attack the antigen. So in the process of doing so, what happens is all the pro-inflammation and the cytotoxic cells secreted and the antibodies released by the B cells. So all these also along with processing the antigen, also attacks the own tissues of our body. So this we call it as autoimmunity. So our own cells, our own tissues are being compromised. So they have been identified by this pro-inflammatory cells and pro-inflammatory chemicals. So they identify our own cells also as antigens in this process of attacking the antigen which has entered into our body. So this autoimmunity will stay, it will last for a little longer time, causing more and more damage to our organs and the tissues, which is unrequired immune response, which has to be modulated, which has to be reduced. Now in this modulation process, the macrophages which initially got activated for attacking the antigen, so they have to polarize themselves, they have to shift their their characteristics of attacking a pathogen to modulation, to reducing the attack. So these macrophages again shift their proliferation, they polarize into a type 2 macrophages, and then they release a set of different cytokines and chemokines, which helps in reducing the pro-inflammatory molecules, which helps in modulating, reducing the secretion of pro-inflammatory molecules. So this is an important procedure